And it's healthcare right in the palm of your hand. Joining us now is Africa 54's health correspondent, Linord Moudou. Welcome, Linord.
Hello, Vincent. Hello, everyone. Well, mobile phones aren't just for talking. The device can be used to improve health and save lives. The mobile market is just exploding. Statistics show about 6 billion people around the world have a cell phone subscription. More than 75% of them are in developing countries. In Africa, an estimated 70% of the population has a cell phone. Now, that's why the global healthcare company GlaxoSmithKline, or GSK, is taking a lead in mobile healthcare. Joining us now is Dr. Allan Pamba, GSK's Director of Public Engagement and Access Initiatives for Developing Countries. Dr. Pamba, welcome to Africa 54.
Thank you very much, Linord.
It's so fascinating to see how technology and medicine have collided to improve healthcare. Now, GSK has partnered in Mozambique specifically with Vodafone in that regard. Tell us more about this new initiative.
That's right. The challenge is that in 1990, 12 million children were dying from vaccinable diseases. Last year, it was down to about 6 million. The opportunity is that we now see a huge mobile phone penetration in Africa. Probably 50% of people there have a mobile phone handset. And we also have vaccines against all the diseases that are killing children. Diarrhea, pneumonia. We're developing a vaccine for malaria as well. And the opportunity we have is to leverage that mobile phone platform to increase uptake of the available vaccines and reduce the number of children that are dying from these vaccinable diseases. So what GSK and Vodafone are doing in Mozambique is a pilot program that will address both the demand side and supply side constraints in accessing vaccine challenges. 3 parts to that pilot, very simple. Mothers and caregivers will have an opportunity to be registered in a government mobile phone platform. They can also register themselves. Once they're registered, they will get text reminders for the child's vaccine schedules or vaccine-related messages. The caregivers will be able to be kitted with an entry-level smartphone, which they can use to register caregivers and mothers. And they can also use it to check a visiting mother, check the child's vaccine status.
Okay.
And then finally, there's also the institutions which will get a text reminder to update their stock so you don't run into stockouts.
So basically the communication channel is established and maintained. Now, are the mothers using their own cell phones?
That's right. Mm-hmm. The mothers already have their own cell phones.
They already have the phone. Now, what do you see as maybe the main challenge going forward quickly?
I think the biggest challenge is to get behavior change. I think that's a piece that's really difficult to address. And there are efforts to see how that is also going to be addressed. But once the system I've described kicks in, then the intention is to increase uptake of vaccines by at least 10%.
And finally, in 30 seconds, how do you see this project moving forward? Right now, it's the pilot stage. What do you see next?
So we're going to pilot this across 100 facilities in Mozambique and look at the data. If we show that 10% or decent increase in the uptake of vaccines, then the expectation is that that solution will be brought to scale across many other countries, across many other vaccines.
And then mothers and babies will be...
And then will impact child mortality through more vaccine access.
Absolutely. Thank you so much, Dr. Pamba. That's all the time we have. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.